Hey guys, it's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering common abbreviations slash, some of the medical words that are used within our department or even amongst the orders you see or common lingo you see at the hospital as that can affect your job to know. So to give you context, I'm an night shift tech, Xray tech, been doing it for over 4 years now. Trauma 3 ER overnights. So as far as the abbreviations on like the orders, you see something like CP, which is chest pain, SOB, shortness of breath, and then you see CRX, that means chest X-ray. Chest tube, sometimes it's just CT. They'll say CT, or there's NG, which is like the NG tube, OG, which is like the tube like for the placement. Central line, there's the little lines, usually just a chest X-ray. I'm trying to see what other ones we have. There's a lot of abbreviations that the doctors use, but as far as how it affects your job, it really, like sometimes you look at an order and it'll say some kind of abbreviation and stuff, and it's a chest. For the most part, unless it's like central line, ET tube, or some kind of foreign body, for the most part, if you get all the chest, regardless of what the order says, you can still get it done. Same thing with like the legs and feet or whatever. Regardless of what that order says, maybe you don't know what it means, but for the most part, they order the foot. As long as you get all the foot in there, you should be good. In worst case, that's as simple as that. Because regardless if it says osteomyelitis or if it says they have a hemothorax or whatever term abbreviate, because sometimes I've Googled stuff and I'm like, oh, it just means they have a pneumo, or oh, that means they have fluid in their lungs, or they have some kind of wound. Like there's one called, it starts with a G, it almost looks like gangrenous, whatever, on the foot, and it was an abbreviated, and I was like, oh, it means this. So some of the times it doesn't even matter what the reason. Well, sometimes you have to change the reasoning just to make it so you don't get in trouble by the rads, or you may have to add a little bit more. But for the most part, you can kind of get an idea of, like, if it's foot, just do what you have to do, shoot the foot, and you'll be okay. Sometimes the patients will ask why they're getting the exam done, and it is somewhat important to know the reasoning of why. Certain patients, sometimes on the floor, I've noticed they'll ask us why, because sometimes the doctors don't come and talk to these people, and they won't see no doctors for days, but they'll keep on ordering stuff, and they'll ask you questions, and you'll look at the order, and sometimes it'll be abbreviated, and you'll be like, if you don't know the meaning, and the doctor's like, if the patient's like, why am I getting this done for? It's kind of important to know some of the stuff, right? Or even when you're talking to other medical people, because sometimes the doctor will be like, oh, I need this, I need that, and they'll whoop out some medical terms, and they're like one time I've had a doctor sit there in the emergency room, and they're like, oh, can you go, I need an X-ray for, let's say, room 5. The patient, we suspect, has pneumothorax, but they won't say chest. And they wouldn't put the order in because they're busy. So, like, sometimes you have to know what the meaning of the stuff is. I mean, obviously, if you ask them, like, so you want chest, and they'll probably tell you. But other times, they're busy, and that's all you'll get. And you'll have to kind of know in your brain what it is and kind of what to expect. But for the most part, they usually put in the orders, and you can kind of, even if you don't know, you kind of get the general gist of it. But for the most part, at our hospital, we see the same things over and over. People with the same diseases, people with the same problems. You see the same things over and over. So you kind of get an idea of what they want based off of whatever the reasoning is. You see the same common ones over and over. So it's not too hard. But yeah, that kind of summarized that. I mean, you're more than welcome to check out my channel where I educate you in the world of radiology. And if you want some laughs and memes, you can check the link below or my shorts. I post more on the TikToks because there's no copyright stuff. But yeah, we'll see you on the next one.